The effects of improper prescribing and the resultant addictions continue to plague American families and communities, and this enforcement action demonstrates our resolve to combat this epidemic and help our communities recover. By pursuing providers who put beneficiaries' health at risk with unnecessary prescriptions, HHS-OIG is putting patients and communities first. Millions of Americans struggle with opioid addiction, and tens of thousands die each year from drug overdoses. The effect on their families and communities is devastating. As the COVID pandemic challenged us these past 2 years, overdose deaths also rose significantly. HHS-OIG steadfastly supports ongoing public health measures and pursues providers who put profits before patients. Our team of investigators and other professionals work tirelessly to detect and curb opioid-related fraud, waste, and abuse in HHS programs. The providers charged in this enforcement action saw their patients as customers and profit centers instead of people deserving care. Holding these providers accountable sends a strong message to others. We will not tolerate abuse of patient addiction for personal gain, and we remain committed to preventing patient harm and neglect. Healthcare fraud is not a victimless crime, and it is not just a financial crime. There are individuals and families who suffer because of the greed and carelessness of bad actors. To protect yourself and your loved ones from opioid-related fraud schemes, have discussions with your providers about care and treatment. If you or someone you know is seeking information related to treatment for substance use disorder, contact the Substance Abuse and Mental Health Services Administration at their national helpline at 1-800-662-HELP. If you suspect that a provider is engaging in opioid-related fraud, please report it to the HHS-OIG hotline at tips.hhs.gov or call 1-800-HHS-TIPS. Information received from the public plays a vital role in our detection and investigation of healthcare-related fraud and abuse. I want to thank the Department of Justice and AAG Polite in particular for focusing on the harmful effects of opioid fraud and healthcare fraud more broadly. The success of this operation relied on the hard work and dedication of the many HHS-OIG agents and analysts that investigated these cases and the close coordination with our law enforcement partners. HHS-OIG is proud to work alongside the Department of Justice, the Appalachian Regional Prescription Opioid Strike Force, the Drug Enforcement Administration, the Federal Bureau of Investigation, state and local law enforcement partners, and numerous Medicaid fraud control units. We cannot do this critically important work without our partners. Thank you, and next I will turn it over to Assistant Administrator for Diversion Control at DEA, Christy O'Malley.